Dr. Rohit here from Srinath Eye Care. So on the 13th of October, as we know, is the World Sight Day. So today I'll be talking about diabetic retinopathy, the causes for diabetic retinopathy, the changes which occur in the eye. Diabetic retinopathy are the changes in the retina which happen due to poor controlled blood sugars. Okay, so poor controlled blood sugars can lead to various changes in the eye. The most common one being bleeding in the eye, new blood vessel formation, vitreous hemorrhage. Okay, so these are the changes which happen over a period of time. So we have to remember that the drop in the vision which happens in diabetic retinopathy is a slowly progressive drop in the vision. Okay, so a regular periodic follow-up with an ophthalmologist is mandatory for those who are having diabetic retinopathy. That's the first important point I want to highlight. Second thing, what is most important? The HbA1c levels. Apart from your fasting and your postprandial levels, you have to see your 3-month blood sugar level, that is your HbA1c level, and constantly try to get it below 6.5 level. That is second thing. Third thing, those who have, what are the changes which happen in a patient? What does the patient complain of? So the patient usually complains of drop in the central vision, waviness of the lines, okay, inability to see or read clearly, frequent change in the glass prescription, frequent blurriness. Okay, so these are the various changes which happen due to diabetes. It can cause cataract in the eye, which is due to sorbitol accumulation in the lens. Second, it can cause diabetic retinopathy, and third, it can cause a frequent change in the spectacle prescription. Why is the frequent change in the spectacle prescription? Again, because of sorbitol accumulation in the lens. Okay, so sorbitol accumulation in the lens results in cataract and frequent changes in the spectacle prescription, and the accumulation of advanced glycation end products in the retina is responsible for the various changes which happen in diabetic retinopathy, like new blood vessel formation, bleeding in the eye, loss of peripheral vision. Okay, so how do we manage diabetic retinopathy? So depending upon we grade the diabetic retinopathy depending upon the severity of the disease into non-proliferative, proliferative diabetic retinopathy and diabetic macular edema. So the treatment will vary depending upon the stage of presentation of the patient and the severity of the presentation. If it is very advanced, the patient has to go for a retinal surgery. If it's picked up early, the chances of visual recovery and having a good vision is very high. Okay, so that is the importance of screening for diabetic retinopathy. So the patient has to regularly get his HbA1c levels monitored, visit an ophthalmologist and get a complete detailed retinal examination once in 6 months, and other changes like lifestyle modification. If the patient is a smoker, avoid smoking, exercise. Okay, so these are the various things which help in getting the sugar levels under control. Also have your lipid profiles constantly monitored in these patients. Thank you.